Welcome, and thank you for joining us for the Wallingford Health Department Summer 2016 Program Update. My name is Eloise Hazelwood. Wallingford Health Department is located in Town Hall, room 215. If you want to contact us, we're available via phone or email. Those numbers will be posted later on this site. Before we begin, I think it's important that we let individuals know that the Health Department provides so much more than just restaurant inspections, septic inspections, and well inspections. Joining me now is Steve Civitelli, our senior sanitarian. Steve, talk to us a little bit about our lead poisoning prevention and some initiatives that are currently going on in Wallingford.
There's a lot going on in Wallingford right now, Eloise. Actually, the state of Connecticut has a very robust program for childhood lead poisoning prevention. The town of Wallingford actually administers those regulations locally. Currently, we're actually doing risk assessments in the home. So part of those risk assessments will actually look at everything environmentally in the home, from defective lead-based paint, potential issues with toys, imported spices that the children could be consuming as part of the process as we go through.
So are you looking at any homes in particular?
Homes are built prior to 1978, which is probably 95% of Wallingford, I would say. So there's a good portion of homes in town that have lead-based paint. The question is whether or not it's defective. Defective lead-based paint is what becomes an issue for a child.
So how many of these homes have you been into in Wallingford to do your assessments? How do you notify the parents?
So there's a process. So in the state of Connecticut, what happens is when a child goes to their annual pediatric appointment, they get screened. It's called a capillary test. It's basically a finger stick. What ends up happening after that is, based on if that level is high, they require a follow-up venous blood draw to confirm whether or not there was actually lead in the blood. We actually track that through the state lead surveillance monitoring system, otherwise called MAVEN. The system actually inputs everything that the providers are doing and something that we can view. Based on that, we send out information to the parents or guardians, and then we try and do follow-up inspections in the home to try and see if we could alleviate the issue before it becomes further detrimental to the child.
So when you go into the home, because there's a child who's been exposed to lead paint, what is it that you actually do in the home?
So we don't take samples at that given time unless the child is poisoned. A lot of the levels that we get are above a 5 for a venous, which is a confirmatory test. Typically what the state has for a poisoned child is above 5, but below 20. Or if we say we have 2 positive tests above a 15, between a 15 and 19 within 3 months. But when we go into homes, we do visual inspections of the paint. Again, anything else in the home that could be an issue. Ceramic pottery that could be used for cooking food items. We kind of do a comprehensive inspection of the entire home to see what else could be happening.
Do you talk to the parents concerning some of the perhaps home remedies?
Home remedies are definitely something that we've come across in the past. We've also come across other things such as altar powder. That was caused a case where the child was, during daily prayer, it was tainted with lead, so we found that was an issue as well. I also came across another case where a family was using an older front door, and they used it converted it to a picnic table, so that the children were actually eating off the picnic table, and that led to an elevated level. So there's a lot that can happen in these homes that we have to evaluate.
So it is still a problem then in Wallingford?
It is still a problem, not just in Wallingford, but in all of Connecticut, and I would say most of New England.
So how many cases do we have of children who have been exposed to lead?
So in 2015, we monitored 27 children, and those encompass both capillary and venous levels. Currently we have 15 open cases that we're monitoring.
So once we find these children, and I know the whole goal behind it is prevention, so what other actions are we doing besides just identifying the child who's been exposed? Are we taking actions and trying to reach out to those to prevent exposure? So
recently the health department, in coordination with the building department and the town assessor, we compiled a list of homes that were rental units that were built prior to 1978. It was a fantastic list. We sent out information to the landlords regarding the potential opportunity for us to come in and do a risk assessment to see if we could then prevent anything from happening for these children to be exposed.
So when you go out to do this preventive inspection, do you give anything as an incentive to the tenant or the property owner?
We have some material that we give. We give them documents that talk about how to deal with lead poisoning in case that they were. We also have other testing material. We have the lead sticks that we could give to them if they wanted to test any other items in their home that we may or may not see at that given time. We also have cleaning materials that we provide them. We have a HEPA vacuum, which is required for cleaning up lead dust. So we have a pretty good assortment of materials that are available to use to help prevent these issues from happening.
I happen to know that you purchased a product that's called a Bitrix. Tell me a little bit about Bitrix.
You don't want it. You don't want to taste it. Bitrix is actually, I believe it's considered one of the most bitter substances in the world, and they actually add it to paint now. If you add it to the paint, that would prevent a child from, say, chewing on a windowsill, because it would actually drive them away from that. So that's a concern, is when you have defective lead-based paint. If a child then comes in contact with that, which we've seen in the past, if you add this Bitrix to the paint over that surface, the child will definitely stay away from it. I know I would.
So that's an easy thing to do to prevent a child from licking a windowsill or...
Most certainly.
Right. So I know that, why is windowsill such an important item when we're talking about prevention of lead poisoning? So
when you're looking at young children, it's somewhat at eye level. And as a child is teething, you tend to see them, basically, they'll gnaw on the wood. And so that's definitely why we first look at the windowsills a lot of times. Plus also in New England in the summertime, we try to open our windows occasionally, which doesn't happen often here. But when we do, you could have that lead dust blowing in from a defective paint from an older window.
Oh, well, that makes sense. So I know that you've also done some programming at the library and with our Spanish community of Wallingford. Can you talk a little bit about those efforts?
Yes, so we have done some work with SCOW to try and get the word out. We have all our information also in Spanish, which has been very helpful in the community. We've had a lot of questions as to, again, the preventative portion of it, because that's the first thing about public health. If we could prevent something, we should be doing it, as opposed to being reactionary. So yes, working in the community has been big for us.
So if you had to give a take-home message to parents or property owners concerning lead poisoning prevention, what would be your 2 take-home messages?
Oh, one, if you have a home that's built prior to 1978, give us a call. Because this way we are more than happy to come out and do a visual assessment of your home or anything else. If you have any other questions, we could go through everything with you. Also ask your provider when you go out if they are doing the capillary screening test. A lot of times you're not even aware that they're doing it. So make sure that you're aware of what's going on.
Very good. Well, thank you very much for that update. I think that we'll be checking back in the fall to see where we are with our lead poisoning prevention updates. Thank you very much for joining me, and we'll be right back. Welcome back, and joining me this segment is Elise Piper, Wallingford Public Health Educator. Welcome, Elise.
Thank you for having me.
I was hoping that you could update us a little bit concerning the Wallingford Health Improvement Plan.
Well, there's a lot going on. To start, I'd like to give an introduction as to how it originated to begin with. It started with the Healthy People 2020 initiative, which is a national health promotion initiative. And from that stems the State Health Improvement Plan, which is also known as the SHIP, or Healthy Connecticut 2020. It has many names. And with that was an initiative to originally actualize measurable outcome in health in the state of Connecticut. And from that came the Wallingford Health Improvement Plan. The Wallingford Health Improvement Plan, or the WHIP, or Healthy Wallingford 2020, mirrors the 7 priorities that the state have found most important or identified from their state health assessment data as very important. And those are including but not limited to maternal, infant, and child health, environmental health, chronic disease, infectious disease, mental health, alcohol and substance abuse, injury and violence prevention, as well as health systems. And Wallingford has taken on those 7 priorities as their own and created subcommittees to spearhead different projects as such throughout the town to hopefully improve the health of their overall town and its residents.
So I know that the health department has also partnered with some of our community partners, such as the YMCA and Masonic. Can you touch a little bit upon one of those focus areas and some things that are happening to try to improve health?
Absolutely. The Wallingford Health Improvement Plan overall is partnered with the YMCA under their Pioneering Healthier Communities initiative. But Masonic Care is an important partner in town in many aspects. And with them, most recently, we were given information regarding COPD, or chronic obstructive pulmonary disease. And with that, we created a flyer, which we're hoping to send out in the electric bills to inform residents on the importance of being aware of others who have COPD, information about the disease itself, ways to improve symptoms of the disease or illness. You'll find on the flyer that there are breathing exercises or techniques that are incorporated to help condition the lungs. And actually, all of this information that was provided to us by Masonic Care falls under the chronic disease initiative or priority that not only the state set, but we mirror as part of our plan.
I know I was surprised to know that you could do occupational therapy in order to increase your breathing ability that's impacted by COPD. So that was a learning experience for me. One of the other programs I know that is part of the WHIP is they're talking about some injury prevention. Mm-hmm. And I think we're doing a falls prevention program.
We are.
So our public health nurse, Anne, had created a brochure on how to get up safely after a fall. And she is brokered with our EMS system to actually go into the home and do free risk assessments so as to help individuals who suffered a fall to prevent an additional fall. I know she also has an exercise component. A lot of times when you talk to people who are elderly, and it's inevitable, we're all getting there, that we get, when we talk about exercise, we say, what do you do for exercise? And a lot of people walk. And walking is a wonderful form of exercise. But it doesn't give that sideways mobility or that flexibility. So part of the exercise component teaches individuals how to do simple, less strenuous exercises to increase their mobility. And I know that we're looking currently for individuals in our community who would like to have a home assessment. And again, it is a free home assessment by our public health nurse and by our EMS staff concerning reducing potential hazards in the home. What are some of the other things that are in that plan?
The Wallingford Health Improvement Plan encompasses all of the 7 priorities that I had mentioned. I also like to note, to tie in with Steve, our lead risk assessor and inspector, that the environmental health portion of the plan incorporates what we're doing and the initiatives that he takes on himself.
That's very good. So that's really quite a very large plan. And I know that it's important that we reach out to our community partners. So are you trying to establish an additional web-based information for residents?
Absolutely. We tried to create, or we have created, a website that has not officially been posted or released to the public or online. We're hoping to do that in the near future. It encompasses some of our subcommittee heads, points of contact, the plan itself, different flyers, programs, initiatives that are going on currently, and hopefully, open up to suggestions, comments, anything as such. But if anyone wants more detail, they can feel free to reach out.
Thank you, Elise, for that update. Much appreciated. And stay tuned for more information. And joining me for this segment is Stephen Civitelli, our senior sanitarian. Steve's going to talk to us a little bit about resiliency in the community and what does that mean from a volunteer aspect. Steve, thank you. Can you tell us a little bit about the Medical Reserve Corps?
Yes, I can actually. The Medical Reserve Corps is a group of volunteers, medical and non-medical, which is important to note because we have a very diverse group of people right now. I believe we have 104 individuals who are volunteers with us. And again, medical, non-medical, and they help backfill in emergency situations in the town.
So can you give me an example of when, from a public health aspect, we would need public health volunteers?
So recently in April, I believe it was a drill that we did with the state of Connecticut. I believe it went from the 13th through the 15th. It was a pod setup, points of dispensing, which was in a response to an event, say for anthrax, for example. We'd have to go and dispense medication to the public in a mass scale event. And we needed volunteers basically to help us do that. The town has limited staffing to do these types of things, and if we had to administer medication to a large population in a very short period of time, we're certainly going to need volunteers to do that.
How large of a population are you talking? Our whole town?
We're talking the whole town, close to 45,000 individuals, I think, from what I last was told.
So we have to distribute medications within a very short period of time. So we have a town plan. And how would we do this? Would we just work with our individual residents, or are there other partners?
We have a pretty intense setup, I guess is the lack of a better term. We have plans that are very intensive for how we would deal with this. The Cliff Notes version of it is that we have what's called closed pods, which are closed populations, our long-term care facilities, our schools, our town hall staff. And so we would separate the medication out from the public pod, which would be held at Sheehan or Lyman Hall.
Thank you. And so the Medical Reserve Corps, is that just a local entity, the Wallingford Medical Reserve Corps, or are they part of a bigger branch?
It's part of a larger branch. It's part of the Surgeon General. It's a federal entity which has, spans across the United States.
That's wonderful. Do you provide training for these volunteers?
We provide a lot of training. We've done CPR AED training, first aid training. We've done self-defense training, which went very well. Mental health first aid training. So no, we've had a pretty good grouping of different types of trainings.
So if someone's interested, how would they find out more about the MRC?
We actually have a website, the MRC website, which updates what's happening in our local units. You could obviously always call the health department, as we have a unit coordinator that helps us coordinate with the volunteers and the other assets in the region, which are out of East Shore Health Department in Brantford. So yeah, there's a few different ways where you could reach us.
Well, thank you very much. It was very informative. And again, if you want to volunteer, give Steve a call. Thank you, Steve.
Thank you.
And thank you all for watching us today. If you need any more information, please contact the Wallingford Health Department. We hope to be back again in the fall with additional programming updates. Thank you.